And so we've got Paul Kelly now, Dr. Paul Kelly. Paul's a lecturer in physical activity for health at the University of Edinburgh. He's been there since August 2014. And he's based at the Physical Activity for Health Research Centre. And he teaches a whole range of things that I'm sure he's going to tell us all about. Thank you very much. Yeah.
Okay, good afternoon. Thank you, Richard, and thank you to the TRL Academy for inviting me down to speak to you today. I'm going to try and address this question, how we can put an economic value on the health benefits that we see when people walk or cycle. So I'm based in Edinburgh, as Richard said, travelled down yesterday evening. I'm in the Park Research Centre, which is led by Professor Nanette Moutry. Those are our research themes, and as you can see, one of a strong focus on walking. So walking and cycling, and those are certainly kind of my areas of most interest. So I'm interested in the benefits we see when people walk or cycle more, how we can measure walking and cycling effectively, and then how we can put an economic value on those outcomes. First, I'm just going to ask for a quick show of hands. Has anyone in the room heard of Heath before? Excellent. Okay, about half. Hands up if you've ever used Heath before. 2 or 3 brave economic modelers. And just show of hands if you've ever done any economic modelling around active travel. Excellent. Okay. So today's talk, hopefully, if you've heard of Heath, we'll give you some of the background and some of the stuff that's going on behind the scenes. And if you haven't, potentially it'll, you can see some potential uses for it in your own work, or can at least understand the outputs if you ever see them coming up in meetings or decision making. So Heath stands for the Health Economic Assessment Tool for walking, and there's one for cycling. They're parallel. It was conceived by the World Health Organization, or the European Office of the World Health Organization. They've been the critical funder and partner over its 9-year life now. It's an economic modeling tool that's designed as an entry-level tool. So it's not meant, you don't need to have a PhD in economic modeling to use it. The idea is that it informs policy and planning, that it informs decision-making with the ultimate aim of increasing walking and cycling. Bit of background, kind of in terms of the rationale behind why we do this. Why do we investigate walking and cycling? Well, low physical activity is now established as the 4th leading behavioural risk factor for global mortality. A lack of physical activity causes almost 10% of the premature deaths that we see globally, and that's just over 5 million deaths every year. It's comparable to smoking in terms of the harms it has at a global and societal level. So that's physical activity. But when we look at the way people get their physical activity, well, we did this here up in Scotland last year. This graph shows the ways that people get physical activity, men and women, and 10-year age brackets. And the different colours show different types, or the contribution that different physical activities make. The higher the bar, the more active people are. Just give you a second to look at that. See if you can see which colour you think represents football, going to the gym, walking, cycling, and housework is in there as well. Yellow, housework. 16 to 24-year-old males don't do it. Everyone else does. You can see sport is this light blue bar. Basically, okay, a bit of it there in the young males and it disappears. Bits of it in the young females and it's almost gone immediately. And yet you think of all the investment and the narrative and the kind of the way sport dominates the conversation when we talk about health or obesity or these sort of things. But what you can see is it's walking that makes the consistent contribution for both women and men across the ages. That's the good news story, and that's the rationale for why we think looking at walking is so important. The other side of that is cycling, the purple. So it's there, and it does sort of maintain a bit into later life, But that's clearly an area where, as a population, we can do better. But that's why we look at walking and at cycling, because of the contribution it makes for all ages and both sexes at a national level. And the pattern in England is very similar. What are the benefits of walking and cycling? Well, you've heard about those in the first couple of presentations. Physical, social, and mental health. Improved air quality if walking and cycling replaces car travel. Reduced CO2 emissions. And importantly, they're equitable and accessible behaviours. You know, the majority of people in your population have the capability to walk. There aren't necessarily financial or equipment or fitness level barriers. So they're very, very important for the populations that are most at risk of poor health and morbidities. So this leads us to the question, how can we put an economic value on the walking and cycling that we see happening? And actually what I'm going to ask you to do, just for 45, 60 seconds, is talk to the person next to you about how you would put an economic value on these health benefits that we see from walking and cycling. Off you go. What do you reckon, Richard?
How would I do it? Oh, I would factor in statistical line for how much you could save on average.
Oh, very good.
But you've seen the slide.
Okay, 10 more seconds. Okay, so clearly some animated discussion about how you could do that, and I think it's important to conceptually think, how can we put a value, an economic figure, a pound sign or a dollar sign on some of these behaviours? And heard a couple of interesting ideas up at the front. And of course, if you said use the heat, then correct, you go to the top of the class. There are a number of ways we can do health economics. You might have heard of DALYs or QALYs. You could think about the cost of treatment of certain diseases or outcomes. You could look at the expenditure for the health service. What about loss of productivity in the workplace? There's a whole number of ways you can do cost-benefit, cost-effectiveness, cost-utility analyses in the health economic sector. But the problem is that doesn't necessarily speak to people who work in different areas, different sectors, with different priorities. So what Heat does is what you do when you're thinking about heat is, well, how do we change walking and cycling behaviours? Road and sidewalk infrastructure, speeds and safety, parking, integration with other modes, service information, and mobility management. And the question is, who makes these decisions? It's not health economists. It's not physical activity lecturers. It's generally not academics. For us, it's the people who work for Transport for London, for the Department for Transport, it's transport planners, it's policymakers, urban design, and it's therefore a need to speak their language and find the priorities and the things that they value, that they can understand. And for that reason, Heat uses VSL. And I'm sure some of you will be familiar with the concept of VSL, the value statistical life. It's the value that a population or society places on preventing a death, on avoiding a death in their society. The current Heat uses the European value of 2.5 million euros. In pounds, that fluctuates as the exchange rate does good or bad things. And that's going to be updated. So I'm going to talk about the latest updates to Heat at the end of the talk. But roughly, it's a value of about 2 to 3 million pounds that society or a population is willing to spend to avoid a death. And unusually for a health economic model, it uses VSL. So that was kind of one of the big decisions that was made when Heath was being designed. There's an assumption there, and that assumption is that by looking at avoiding a death or avoiding mortality, you're capturing the other important harms that lead on that pathway to the mortality. So things like incidence of disease, treatment costs, reductions in quality of life, reductions in mental health, and social connectedness, and reductions in loneliness and isolation. So while these aren't explicitly captured, the assumption is that these are all things you would see as precursors to the mortality that resulted as a lack of physical activity in this case. Next question that you need to know if you're going to do this is, how good is walking and cycling for your population? And this is how we do it. We take an imaginary city or imaginary population, imaginary group of people where there's no walking or cycling taking place. That's city A, we shall call it. And we compare it to city B, which is identical in all other aspects, with the one difference that the population of that city walks for 30 minutes every day. Now, we take a mortality rate, and this is kind of a sort of Scottish figure. It's a bit higher than the English figure, but very roughly 880 annual deaths, or a mortality rate of 880 per 100,000 people in the city where there's no walking. So again, what I'm going to ask you to do, just it's a bit of a sort of guessing game, is I'll give you 30 seconds, talk to the person next to you. What do you think is the mortality rate in City B, where people do walk for 30 minutes every day? Off you go. Okay. Is anyone brave enough to shout out their guess? 700. 700, good guess. 600. 220. Higher, lower. 440, good guess. When you look at the evidence, when you look at studies that have done this, and the Copenhagen City Heart study that was mentioned earlier was one of the studies that factored into the cycling calculation. You find that it's about 11% reduction in annual mortality, in mortality rate. So that equates to about roughly 100 fewer deaths in City B, if this imaginary case that everyone walks for 30 minutes every day. And that's what that's where the health side of the science feeds into the tool. So we can take these numbers and we can say, well, what's the proportion that walks or cycles, and how much do they walk or cycle? And we can apply a proportional risk reduction to get that mortality change or mortality difference from the walking or the cycling. It just so happens that the values are very similar for walking and cycling. It was 11% reduction for walking, a 10% reduction for cycling, and that's an assumption of 30 minutes of walking or 20 minutes of cycling. And that's because cycling is a more intense behavior. You can accumulate the benefits slightly quicker. And all of this is kind of put down or published in this 2014 paper that we put out that explains how we did this and how we came to the conclusions and where the evidence came from to generate these risk reduction figures that feed into the health economic assessment tool. One of the questions that we got asked frequently when the first sort of version 1 or 2 of Heath went public was, what about the increased risks? And we spoke about the increased risks of traffic incidents, collision incidents earlier in the day. And another question that came up was, what about exposure to pollution? If I walk or cycle more, surely I'm exposing myself to more emissions or pollution, and therefore that counteracts any harms. So with the group from CEDA, James Woodcock and Marco Tainio led this work, we investigated that question. And what we found was at 75 minutes of walking, at 75 minutes of, is it walking or cycling on this graph, every day, the benefits still outweigh the risks, assuming a concentration of 50 micrograms of PM2.5. So that's a very high level of cycling where the benefits outweigh the risks. And indeed, it's 300 minutes of cycling a day, 6 hours of cycling a day, where the disbenefits of the pollution start to overtake the positives of the physical activity. Now, okay, you might have some professional cyclists or some cycle couriers, but for the majority of our population, 99.9%, they're going to be in the green, seeing more benefit from the cycling than disbenefit from the air pollution. And they ran the models for various levels of pollution of 2.5, particulate matter 2.5, and even up to 95 micrograms, which is only 1% of cities in the world have that kind of level on a regular basis. You're still seeing greater benefits than disbenefits. So you can be confident when looking at the benefits of walking and cycling, that the activity you're getting, the active travel you're getting, will do more good than the exposure to the air pollution. And the next generation, the next version of Heath, will actually give you some calculations on that as well. It will factor that in so that you can use it as part of your decision making. So for the final part of the presentation, I thought I'd give you some examples of using Heath and show you how it can be used to value walking and cycling. This is what it looks like. It's available. It's an online tool that's freely available. There's the link, and I assume that these slides will be made available to you all afterwards. And like I say, it's meant to be a user-friendly tool. So it's not meant to be off-putting. If you've never done economic or transport economic modeling before, you should be able to get the hang of Heath in about 20, 30 minutes. And there's online training available as well. So there's user manuals and there's online training. It's really designed to be accessible to factor into people's ongoing decision making, rather than a tool that only specialists can get their head around. That's a specific question it asks, and that's what it will ask you when you go into the tool. How many people and how much do they walk or cycle? Those are the pieces of information, the critical pieces of information that you need if you're going to run a Heath model or a Heath scenario. A collaborative project, must mention all of the collaborators, and a very large team went into it. I can see a few people in the room as well who've contributed heavily to this project. And I like this slide because it shows how it was a multidisciplinary tool. This wasn't just health researchers getting together and talking about how good walking is. It was meant to be collaborative and use the expertise of many different sectors as it was designed and the various versions released. This is a schematic of what the Heath looks like, and it just illustrates that there's two places where you put in the critical information: the volume of walking or cycling and the size of the population that stands to benefit. And then there's the risk reduction that we spoke about before, the 10%, the 11%, that gets applied to those figures to give you the outputs from the tool. If you've run a Heath model before, you might recognize this screen. This is what it looks like after you've run a model. This is the primary output page. And what it does is it starts by telling you the reduction in annual death rate. So in this particular scenario that was modeled, there were 19 fewer deaths every year as a result of the cycling that was taking place in that population. And then what it does is it applies the VSL, the value of statistical life, to those deaths to give you various economic outputs, economic values. And it discounts against future savings, if it's over 5 or 10 years, and you can set your own discount rates if you wish. And You can decide how long you think it takes the benefits to accrue. If you've done an intervention, how long does it take full effect to take place? You can factor all these things in to get the economic outputs from the tool. There are 3 primary ways it can be used. Number 1 is to place a value on existing levels. So we heard some statistics today about cycling levels in London or active travel levels in the United Kingdom or in England. If you know that 40% of your population walks for travel on a regular basis, you can put an economic value on that figure. It's how much good is already happening as a result of existing infrastructure, existing policies, and existing interventions to promote walking. And I think that's a really important argument. Sometimes we focus heavily on the negatives, if you don't do this or you don't do that. But sometimes telling the positive story can be a good way of building the rationale for doing more of the same, or for increasing investment or public support for the active travel that we're trying to promote. The second way is to try and model or put a value on changes in these levels. So we saw some changes in cycling levels over the sort of last 10 or 12 years. You could put a value. If you know how many more cycle trips there are, and you can make assumptions about how many people are doing them, you can put a value on that. So you can say, well, we invested this much in increasing cycling or increasing walking, and this is the health economic benefits we saw as a result. And then the third way is about modeling interventions. So if you build a piece of transport infrastructure, or you do a policy, or you do a kind of a direct intervention to increase walking or cycling, you can count the numbers of people that use it, and again, get an economic value for the health benefits that have happened as a result of that intervention. You can either do it beforehand as a sort of impact assessment to justify the investment, or you can do it afterwards as a way of evaluating the health economic effects that you had. Example 1, here's an example from Scotland. So over to Glasgow, the Centre for Population Health, they used cordon count data in and out of the centre of Glasgow to estimate the annual number of cyclists. And then they put those values into the Heat to get the economic value of the cycling that was already taking place, as a way of justifying the existing infrastructure, defending the existing investment in infrastructure in the city of Glasgow. Number 2, looking at changes. So here's a kind of hypothetical example I did in preparation for this talk. If we take, for example, the London Borough of Tower Hamlets, and Wikipedia tells me it's roughly a population of 300,000. If we make the assumption that a third of those people are adults between 18 to 65, we can model changes. So what would be the value if 10% of that population increased their walking by 20 minutes a day? And you can see here how the outputs you get are dependent on the quality of the assumptions you make in the front end. Heath told us that it was almost 4 deaths per year annually that get avoided. Now, that might not sound like a particularly impressive figure. I think saving 4 deaths a year is very important. But if you remember, what Heath does is it has the assumption that there's all the surrounding burden and health burden and disease and mental health and social health that would be precursors to those theoretical 4 deaths. And of course, with a value of statistical life of £2 to £3 million, those still make substantial savings on an annual basis. So again, you can start to look at the health benefits, the economic benefits that would accrue over 5 or 10 or 20 years if you were able to achieve changes like that. And then finally, if you're looking at an intervention, so I was looking at potential interventions that might be happening in London and loved the idea of the cycle bridge over the river. Either you could count the number of cyclists that use it, or you could model the number that you think will use it. And if we assumed it was 800 an hour who were new cyclists, who were commuting on an average journey of 5 kilometres each way, again, you can see Heath will give you an economic value on that additional cycling that you've been able to stimulate or cause. Another example of evaluating interventions, Andy Cope and I are looking at the effects of the 20-mile-an-hour scheme that's come in Edinburgh. And we're first going to see, do walking and cycling levels change? And if they do, we'll be able to use Heat to put an economic value on that. So in summary, Heat is a tool that can facilitate transport and urban planning decisions by adding into the equation a value of the health benefits. It's been used a lot worldwide. There's a sort of whole summary of documented case studies where people have used the tool from across the world. And like I said, the new version 4, is coming out this month, and this includes air pollution, carbon emissions, it has improved scenario modeling, and it has the updated values for statistical life. Of course, there are limitations around Heat, and I'd be very happy to discuss those if people have questions. It is meant to be deliberately a simplified tool. That's seen as one of its strengths, but there are more sophisticated models out there, and for example, the ITHM model that comes from Cambridge is a good example of that. And of course, we don't know how well we capture really important things like mental and social health. I always like to finish on this point, that the money is important, but I don't think it's the only reason we should be promoting walking and cycling. I think it's just part of the discussion, and I think that's really important to remember. When we're talking to some people, the economic value might be very powerful, but when we're talking to the public, there might be other things that they value much more important than the pound signs. So that was a brief summary of the health economic assessment tool and how as public health researchers, we've tried to generate something that can feed into transport decision-making. Thank you very much for your attention, and if you want to know more about it, please come and find me later in the day.
Thank you very much. Again, we have time for a few questions. One at the back. Might have time for 3.
Hello, it's Robert Huxford from the Urban Design Group. Just a question about discounting benefits. We're talking about discounting human lives. One of the main principles of sustainability, perhaps the only principle, is intergenerational equity. When we apply a discount rate to future lives, we're actually saying that a future life is of less worth than a life now. And well, I'll leave that with you. And perhaps it's something for all of us to consider. And in routine transport appraisals, we maybe shouldn't be doing this. It's fair enough to do it on an economic basis when there's a financial return involved. But when we're dealing with human lives, it's not actually moral, and it's not actually in accordance with the principles of sustainability.
Thank you for that point, and I very much agree. The discount rate is one of the modifiable parameters, so you can set it to 0, which I think you've made a very good case of doing so. It's there because depending on the purposes or the needs of the users, some people want it, but no, thank you for that point.
And if I may, I'm just going to jump in there as well. When we have the panel discussion, I'd really like to come back to that point. Something we've done a lot is looking at this for if you improve a vehicle, for example, what's the cost to the motor manufacturer to change that vehicle and the regulator and so on. And we use this approach. We did it last year for Latin America, and we got a total of 140 billion saving US dollars if we put in minimum vehicle safety standards into Latin America and some of the major zones. And that changed the argument. So it can work, but I really take the point. There was one here as well. Thank you, sorry.
Thank you, Paul. Very interesting presentation. Peter Walsh here from WSP. I conduct health impact assessments, and as I execute those, often it's not just the nature of the scheme and the health benefits through the scheme, but it's the population that use the scheme, particularly the target population, whether they're vulnerable or whether they're high risk. I noticed 2 of the examples you used, Tower Hamlets, very deprived area, one of the most deprived areas in the UK, and there was a West London cycle scheme. Now, those 2 populations I would consider to be very, very different in terms of their where they are, in terms of their health risk. So is there any way in which, I understand Heat is a generic model, but is there any way in which you can make any variations within Heath in terms of your target population or your baseline population for the health benefits?
Thank you for that question as well, and it raises a really good point. The kind of first level of Heath, you wouldn't need to know or have data on those things to get to run a scenario and get a value. But as you become kind of more familiar, or you have more data, or you become a more advanced user, that's a very good example of one of the parameters that you can play with. So you can say that I'm looking at a highly active population, so they're quite active already, and that means that you'll get less benefit from the increase in walking and activity. Or you can look at an older population or younger, and there's default values for background mortality rates. You can set that by country or for the whole European region. And again, as you become a more advanced user, you can start playing with those to do exactly what you said, and try and get more accurate models, more valid models based on the population of interest.
Last question, I think, was here. Thanks, Jane.
Thanks. So, Tony Duckenfield from Stuart Davis Cleeve. Yes, I've used the Heath tool, and I can confirm it is easy to use, which is great. And actually, what I've used it for particularly is the impacts of more soft measures, so personalised travel planning. So I think a lot of what we talked about is actually infrastructure, and that's all is easy. But it can be used for soft measures, just a bit of tweaking there. But my question was actually about the outputs. So the value of statistical life and the kind of BCRs you get are slightly abstract for a lot of the, we talk about different audiences. For a lot of the audiences I'm dealing with, it is a bit abstract. What would be a great output, and I think it should be doable, is what's the value of the savings and health spending that you get? Do you know if there's anything, would the fourth version 4 have that, or do you know anywhere where you can get that kind of output?
Again, thanks for the question, and it was great to meet an end user of the tool. The question of savings for treatment of diseases and conditions comes up every time the group gets together, and we discuss at length, how would you do that? It would be absolutely fantastic to run a model like that. The problem becomes, we might have values in England, but if we want to make a tool that's usable across Europe, we might not have values from Austria or Bulgaria or Poland, for example. So there's a huge layer of complexity to try and do exactly what you've just said. But I will say that you're not alone in requesting that. It comes up every time we meet because it seems to be so valuable to the users. I could only encourage you to contact the Heath team and log that, because the more people who ask, it will eventually be something that I think we'll just have to include.
Yeah, I'll do that.
Thanks.
Thank you very much.
Thank you.